Hello, this is Dr. Sanjeev Bagga, Diplomat of American Board of Radiology, Neuroradiology, and Nuclear Medicine. I shall be discussing state-of-art PET-CT imaging. It is important to know that biodistribution of F18 FDG is affected by blood glucose levels. High levels of glucose in the blood cause high insulin levels. High insulin levels degrade scans by increasing muscle uptake of FDG. Insulin released in response to eating or given to the patient by the doctor or by the patient himself or herself will cause excess muscle uptake. Patients should not eat after midnight and have a light meal in the evening without alcohol the night before. If the exam is in the afternoon, the patient can have light breakfast 4 hours before their examination and medicines can be taken as have been prescribed. The patient should drink at least 1 liter of fluids 2 hours before the exam. The patient should not drink coffee, caffeine containing, or sugar free beverages or drinks. The patient should be kept warm for 30 to 60 minutes before the FDG injection. The patient should avoid strenuous exercise for at least 6 hours and preferably 24 hours. And the imaging should be done with the arms above the head. If plasma glucose level is less than 200 mg per deciliter, the study can be performed. If more than 200 mg per deciliter, the study should be rescheduled. The aim is to keep glucose and insulin levels low. Insulin is not given to reduce glucose levels as it leads to greater muscle uptake of FDG unless time between the subcutaneous administration of insulin and IV administration of FDG is more than 4 hours. Type 2 diabetics imaging should be done in the late morning after overnight fast. Blood glucose levels should be checked upon arrival and patients should take oral medication to control their blood sugar as usual. Type 1 diabetic patients can eat a normal breakfast around 7 a.m. and get the normal amount of insulin. FDG can be injected 4 hours after subcutaneous injection of rapid acting insulin or 6 hours after subcutaneous injection of short acting insulin. No food should be taken after that. Patient can drink water. FDG is excreted through the kidneys. Typical doses 10 to 25 millicuries. Lower doses can be given if the scanner cannot process high counts. Imaging is performed 45 to 60 minutes post-injection. It is ideal to inject in the opposite side for breast and melanoma lesions. Imaging after 2 to 3 hours is ideal if the tumor has low FDG avidity or for treated lesions. Patient is told to avoid talking or chewing gum. PET attenuation can be overestimated with IV contrast agents. These appear as areas of high FDG uptake. These changes correspond to venous vessels carrying undiluted contrast to the heart. If oral contrast is uniformly distributed, there is minimal overestimation of SUV. In patients with GI stasis, there is increased CT attenuation resulting in inaccuracies. Water attenuation, oral contrast agents that do not contain glucose can be used. These include ditrizoate meglumine and ditrizoate sodium solution 8 ml in 500 ml of water with 0.02% locust bean gum and 2.5% mannitol and low density barium. To reduce brown fat uptake, 5 mg of IV diazepam is given 10 minutes before FDG injection or 80 mg of propranolol is given orally 2 hours before FDG injection.